चलिए शुरू करते हैं अपने फर्स्ट क्वेश्चन से कि विच ऑफ द फॉलोइंग इज अ डायरेक्ट रेनिन इनहिबिटर। रेनिन क्या है सर? रेनिन एक तरीके का एंजाइम है। क्या है सर? एंजाइम है जो कि किडनी से रिलीज होता है। कहां से रिलीज होता है? किडनी से रिलीज होता है जब भी हमारी किडनी में जो ब्लड का प्रेशर है वो कम हो जाता है, या फिर किडनीज के नेफ्रॉन्स में जब भी सोडियम का कॉन्सेंट्रेशन कम फील होता है तो भाई रेनिन रिलीज होता है। अब रेनिन को इनहिबिट करने के लिए जो ड्रग हम यूज करते हैं उस ड्रग का नाम हमको बताना है। तो क्या वो एलिस्काइरिन है, क्या वो फोसिनोप्रिल है, क्या वो निकोरैंडिल है, या फिर कैप्टोप्रिल है? ठीक है। अब भाई इनकी क्लासिफिकेशन लर्न होना बहुत जरूरी है। अगर आपको क्लासिफिकेशन ही याद है तो भी आप ये क्वेश्चन कर पाएंगे। देखिए सबसे पहले अगर हम फोसिनोप्रिल की बात करें तो दिस इज अ प्रिल, एंड कैप्टोप्रिल और फोसिनोप्रिल दोनों ही क्या है सर? दोनों ही एस इनहिबिटर्स हैं, यानी कि एंजियोटेंसिन कन्वर्टिंग एंजाइम इनहिबिटर्स हैं। और बात करें निकोरैंडिल की तो निकोरैंडिल एंड पिनेकेडिल, निकोरैंडिल एंड पिनेकेडिल ये क्या है? पोटेशियम चैनल, पोटेशियम चैनल ओपनर्स हैं। क्या है सर? पोटेशियम चैनल ओपनर्स हैं। और बात करें एलिस्काइरिन की तो एलिस्काइरिन इज अ डायरेक्ट रेनिन इनहिबिटर, डायरेक्ट रेनिन इनहिबिटर। तो यहां पे एलिस्काइरिन जो है वो हमारा सही आंसर है। ठीक है। तो यहां से आप देख लेंगे कि भाई एलिस्काइरिन के क्या क्या इंपॉर्टेंट पॉइंट्स हैं और कौन कौन से इंपॉर्टेंट क्वेश्चंस एलिस्काइरिन से रिलेटेड बन सकते हैं। तो पहला आपको जो नोट करना है तो जो पहली चीज है दैट इज एलिस्काइरिन इज अ डायरेक्ट रेनिन इनहिबिटर यूज्ड फॉर ट्रीटमेंट ऑफ हाइपरटेंशन। दूसरा है इट इनहिबिट द रेनिन द ब्लॉकिंग ऑफ एंजियोटेंसिनोजन टू एंजियोटेंसिन 1 रिड्यूसिंग द प्रोडक्शन ऑफ एंजियोटेंसिन 2। ठीक है। एंड ऑल्सो दिस reduces the vasoconstriction and lowers the aldosterone secretion leading to decreased blood pressure and fluid retention। देखो थर्ड पॉइंट बहुत इंपॉर्टेंट है क्योंकि थर्ड पॉइंट से आपको क्वेश्चन बन सकता है कि विच इज द ड्रग विच reduces the vasoconstriction, lowers the aldosterone secretion and leads to decreased blood pressure and fluid retention। तो भाई इसका आंसर क्या होगा सर? आपका रेनिन हो जाने वाला है। वहां पे ऑप्शन से आपको कंफ्यूज कर सकता है बट रेनिन इसका आंसर हो सकता है। अब भाई रेनिन के लिए लास्ट पॉइंट भी बहुत इंपॉर्टेंट है दैट इज contraindicated in pregnancy and should not be combined with ACE inhibitors or ARBs in diabetic patient due to increased renal risk of renal complications। ठीक है। ARBs के और ACE inhibitors के साथ वैसे भी हम नहीं दे सकते क्योंकि वहां पे डायबिटिक नेफ्रोपैथी का भी हमें साइड इफेक्ट देखने को मिलता है। So now let's understand very quickly what is renin angiotensin aldosterone axis system. So first if you are clear about this system, you will get to know how. So let me analyze this. You will get to understand how renin works, what is the work of renin enzyme. Second, what is ACE enzyme and how it works. Third, what is angiotensin 2 receptor functions. So these are the three things which you will understand, and also the drugs associated with them like renin inhibitors, ACE inhibitors and direct AT1 inhibitors. Okay, so these are the three things which we will be learning here. So one by one let's also discuss. So this is our lung, this is our heart, this is our kidney, and this arrow signifies the renal perfusion, the blood going to the kidney, and this arrow signifies the enzyme coming back from the kidneys. And this is our liver. Liver produces a lot of proteinaceous substances. One such substances we are going to discuss is angiotensinogens. And here we have the brain, which has pituitary gland, as well as few other things which we are going to discuss. Okay, so let's discuss it one by one. Okay, and this circle is our circulatory system. This is our circulatory system in which the blood is flowing. Okay, let me also remove this. Okay, the first thing what happens is, let's take a case that a person or a patient is losing blood due to some accident. Okay, he is losing blood, and due to losing this blood he is facing few issues. The first issue is he is having blood volume reduced or reduced blood volume because the blood is oozing out. The second thing he is facing is due to the blood volume is reduced, he is also having lower blood pressure. These are the two problems he is facing, and how the body will take over and manage this situation through, and this situation is managed through renin angiotensin aldosterone axis. So see, the blood is oozing out. That means the blood in the circulatory system is reduced. Now when the blood is reduced, the renal perfusion, the blood going to the kidneys are reduced. So what we will see is reduced renal perfusion. So due to reduced renal perfusion, kidney releases a enzyme which is called renin. So kidney releases a enzyme called renin, and renin comes into play into the circulatory system. So let me make it blue. So here we have renin. Okay, this should be beautiful. Okay, R, all right. Okay, now it looks good. Then we have liver. So what liver does? Liver releases a proteinaceous substance that is called angiotensinogen. Angiotensinogen. Angiotensinogen by help of renin converts to angiotensin 1. And angiotensin 1 by help of an enzyme which is present in lungs, it converts to AT2. Do you know the name of enzyme? It's a very famous enzyme. So the name of enzyme, yes, do you know? Okay, so the name of enzyme is ACE. ACE. That is angiotensin converting enzyme, and these are present on the endothelial cells of lungs. Okay, so this is the exact location. If in case someone asked where in the lungs ACE enzyme is present, so you can say in the endothelial cells of the lungs. Okay, so now we have angiotensin 2, and this is the factor which works on all the part of our physiology. So first thing it will do, what angiotensin 2 does is, the first thing it will do, it will work on heart, and it will increase two things: systolic blood pressure, and also it will increase the diastolic blood pressure for the heart. Second thing which it does, it works on the beta 1 receptor of JGA, that is juxtaglomerular apparatus, which is present in kidneys. And what it does, through juxtaglomerular apparatus, it increases the blood volume. So what it does is, it retains sodium and water. And if it retains sodium and water, the blood volume is increased. So here we have problem of decreased blood volume. Here we face the problem of decreased blood volume. So let me mark it decreased. So here we are compensating it through increased blood volume through JG receptor by action of angiotensin 2. Okay. Now the next thing it does, it works on, so let me go by this way. So it works on the brain, on the pituitary gland, and through pituitary gland it releases a hormone which is ADH, that is our nothing but vasopressin. And vasopressin, what vasopressin does is, vasopressin adds extra water to the blood. Vasopressin also helps retention of water. So if the water is being retained, it will also increase the blood volume. I will write blood volume. So blood volume will go up. Okay. So angiotensin 2 also works on, I would write bradykinin. So another function of angiotensin 2 is it breaks down the bradykinin. And bradykinin, when the bradykinin is being broken down, the mucus formation are continued. So basically bradykinin and mucus are enemies of each other. So when bradykinin are broken down, the mucus are being formed. And when the breakdown of bradykinin will be stopped, the mucus formation will go down. So angiotensin 2 also work, okay? Angiotensin 2 also work on adrenal gland, on the zona glomerulosa, and it increases the aldosterone activity. It releases the aldosterone, and through aldosterone increases the sodium ATPase activity, sodium potassium ATPase activity, and through which the sodium and water retention takes place, and thus blood volume goes up. This was the problem. Let me use the pointer. So this was the problem: blood volume and blood pressure. Blood volume we have compensated through receptor in the JG, yani ki glomerular apparatus, also through the vasopressin, also through the zona glomerulosa aldosterone system, and then the blood pressure we compensated through the heart activity, the angiotensin 2 activity on the heart, that is increased systemic blood pressure as well as diastolic blood pressure. Okay, so this was a very special condition. Now let's remove this condition, that there is no blood loss. There is no blood loss. In the normal body, the blood pressure is increased, the diastolic blood pressure is increased, and the blood volume is increased in the normal body. So how will we get over it? So we will use 3 drugs. So the first drug is renin inhibitor, that is aliskiren. So instead of renin inhibitors, let me write aliskiren. So what aliskiren does is, it inhibits inhibits. So this is our L-skyrine. It is inhibiting, see, it is forming A and it is inhibiting the renin. So when renin is inhibited, the level of angiotensin II goes down. And when it goes down, the systemic blood pressure goes down, the blood volume goes down. Also, due to less ADH activity, the vasopressin release is down. And since vasopressin goes down, the blood volume also goes down. Okay. And also the activity on the the zona glomerulosa goes down. Aldosterone release is decreased. Sodium potential ATPase activity is reduced and the sodium and water retention is reduced, and thus the blood volume is also reduced. And this is how we compensated each and every area, and this is how we decrease the blood pressure. Another drug which are being used in hypertension is, in this category, is ACE inhibitors. That is, so before ACE inhibitors, let's talk about angiotensin 1 inhibitors. That is this. So if angiotensin 1 are inhibited, if these are inhibited, what's going to happen? Again, the angiotensin 2 will reduce, the renal perfusion, the receptor of JGA will have less activity since blood volume will be reduced, and also the systemic blood pressure will also be reduced. And then on the zona glomerulosa side, the sodium potassium ATPase activity will go down due to reduced aldosterone and the blood volume will go down. Also on the ADS, the same activity will follow, only there will be one side effect which we will discuss. But before that, let's discuss our third drug. So for angiotensin 1, we have the drugs ending with sartans, losartan, candesartan, okay. And the last category is ACE inhibitors, that is angiotensin converting enzyme inhibitors. So this is our ACE inhibitors, okay. So for ACE inhibitors, when ACE will be reduced, there would be no formation of angiotensin 1 to angiotensin 2, and the same activity, the same actions of angiotensin 2 would be reduced. Okay. Now we know the drugs, now we know the physiology. Let's understand the side effects. What happens? We learn that when the breakdown of bradykinin is happening, when the breakdown of bradykinin is happening, the mucus is being formed. But when the angiotensin 2 receptor are reduced, when angiotensin 2 is reduced, the bradykinin activity is now not breaking down. We are not breaking down bradykinin. So breakdown of bradykinin will reduce and the mucus formation will be affected. So that means the mucus formation would be reduced. So let me mark, mucus formation would be reduced. So if mucus formation will be reduced, what will happen? It will cause a side effect known as dry cough. What it will cause? Dry cough situation it will cause. The whole activity of renin angiotensin aldosterone axis works. Let's move to our next question. Here you can see I have already marked the thing you have to learn. First thing, the classification. Let me take another pen. So the first thing you'll have to learn is classification of antihypertensive drug. You will see here diuretics, you will see renin angiotensin system inhibitors. First is L-skyrine, second is AT1 receptor blocker, that is angiotensin receptor blockers. Then we have ACE inhibitors. ACE inhibitors are drugs ending with pril. Angiotensin 1 receptor blocker, drugs ending with sartan. Okay. All right. Let's move to our next question. All of them are prodrugs except. So this is a very special question. See, we have prils. Prils means these all are ACE inhibitors. These all are ACE inhibitors. So here it is asking which of these is not a prodrug. So you will have to mark that lisinopril, yes, it is a prodrug. Enalapril is a prodrug. Fosinopril is a prodrug, while captopril is an active drug. So it is already active. It does not require to metabolize in the liver to get active. So captopril will be correct answer. So here you have to learn all ACE inhibitors are prodrug except captopril. Captopril are active ACE inhibitors while other metabolize in liver to convert into active form. Let's go to our next question. ACE inhibitor which is excreted through both biliary and renal system. So it is asking about the excretion part. Now ACE inhibitor which are, so usually ACE inhibitors are excreted through renal system, but there are few ACE inhibitors which uses the balance system, that is biliary and renal system, both the systems. So which of them are the correct answer? So lisinopril, no sir. Captopril, no sir. Enalapril, no sir. Fosinopril is the correct answer. So fosinopril is the only drug which uses the balance system of excretion through biliary and renal system. Okay, here you can refer. Next question, a patient with hypertension and hyperlipidemia. So hypertension means elevated blood pressure. So here, let me use another pen because the blue is not writing. So elevated blood pressure, and here is elevated lipid level. So hypertension, hyperlipidemia would benefit most from which of the class of antihypertensive drug? Having both hyperlipidemia and hypertension, which will be the drug of choice? Is it going to be beta blockers? No, sir. Is it going to be calcium channel blockers? Maybe. Is it going to be renin inhibitors? No, sir. Or is it going to be ACE inhibitors? No. So, calcium channel blockers are the categories of drug which are used in hyperlipidemia as well as in the hypertension. So, if the category is falling, that person is having hypertension and hyperlipidemia, we will always go for calcium channel blockers. We already have learned the trick for calcium channel blockers, that Viro means verapamil, Dil means diltiazem, Am means amlodipine, and Nahi means nifedipine. So this is the trick. Viro, ka, dil, am, nahi. Okay. So these are the effects, and you can refer it from here. So that video should not get long, I will move on to the next question. Class of drug useful in diabetic nephropathy and diabetic retinopathy. So diabetic nephropathy we have already discussed. For diabetic nephropathy, which are the drugs which are drug of choice? But here we have also included diabetic retinopathy. So for diabetic nephropathy and retinopathy, I think the question is going to be same. Beta blockers will not be the answer. Calcium channel blockers will not be the answer. Renin also will not be the answer. I think ACE inhibitors would be the correct answer, because ACE inhibitors are drug of choice for diabetic retinopathy, and also in the, it is now have been found that it is also useful in preventing the diabetic retinopathy. So basically these are the prevention. So which are the drug which will prevent diabetic retinopathy and diabetic nephropathy? So that drug would be ACE inhibitor. Which antihypertensive drug is most likely to cause orthostatic hypotension as a side effect? Orthostatic hypotension is also known as postural hypotension, and everybody once have faced this kind of situation. So have you ever wondered that you are waking up from your bed and you just raised up and you suddenly feel that you are feeling vertigo or you are feeling blackout? So this is the kind of situation, this is the kind of symptoms we feel in postural hypotension. So which of the drug is it going to be? Is it prazosin, or is it lisinopril, is it clonidine, or is it nicorandil? So the correct answer is prazosin. So prazosin is the correct answer, and reason being, prazosin is an alpha-1 adrenergic blocker that causes vasodilation, and due to vasodilation there is relaxation of vascular smooth muscles. So when vascular smooth muscles are relaxed, it leads to the pooling of blood, and it also leads to decrease in peripheral resistance and blood pressure. So when the peripheral resistance is reduced and the blood pressure is reduced, the blood is basically pooled in the smooth blood vessels. Okay, and most of the blood are collected in the venal area. Around the 70% of blood is always present in our venous area. So this is why the postural hypotension is felt when prazosin is being taken. Okay, and this is why always the first dose phenomenon of prazosin is postural hypotension. And then we can also see the other side effects of prazosin, that is orthostatic hypotension, tachycardia, vertigo, and sexual dysfunction. And the examples include doxazocin and prazosin. Okay, and these are the brand name Cardura and Minipress. Which antihypertensive drug is most likely to cause hyperglycemia as a side effect? See, we are trying to learn and see how the questions are done. So if there is a problem with questions, we can solve it. If there is a problem with the options, we can solve it. So when you will be giving exams, all you have to do is how we can get to the correct answer. Sometimes the problem we feel is we are clear with the option that okay, these two options are not the correct answer, but we are confused between the two options. So how you will eliminate all the incorrect options and you will get to the correct options? This is what we are going to achieve in here. The success looks like for you is how you are going to reach to the correct answer and how you will make the most out of it in the exams. So in this chapter, in this video, all we are going to learn is the antihypertensive drugs, their actions, their mechanism, their side effect. So any questions from any aspect of antihypertension chapter should not be left. So the question is, which antihypertensive drug is most likely to cause hyperglycemia as side effect? Going to be prazosin, hydrochlorothiazide, furosemide, or nicorandil. I think we have already discussed the hyperglycemia in our previous questions. So I'm going to jump directly to the answer. This is going to be our thiazide diuretic, that is hydrochlorothiazide. So thiazide causes hyperglycemia. So in the thiazide diuretic, you can also see here hyperuricemia, hyperglycemia, hypotension, hypovolemia. And in the loop diuretics, we have already discussed ototoxicity, hypovolemia, and decreased level of sodium and potassium and magnesium. So these are few famous side effects which are also being asked in the questions. So for the ototoxicity, I think we have seen in 2022 NIPER, there was a question that the side effect of loop diuretics. Potassium sparing diuretics, it increases the potassium level and causes metabolic acidosis with gynecomastia. So this is one of the important side effects. For carbonic anhydrase, the potassium level are decreased and it causes metabolic acidosis. Okay. Next question, which antihypertensive drug is most likely to cause a metallic taste as a side effect? So there are antihypertensive drug which will give a metallic taste as a side effect. So is it going to be captopril, amiloride, nitridipine, or nicorandil? So is it going to be captopril? Maybe. Is it going to be amiloride? No, sir. Is it going to be nitridipine? No, sir. Is it going to be nicorandil? No, sir. So captopril is an ACE inhibitor and it gives metallic taste. It gives metallic taste and it is also an active drug. It is not a prodrug. Okay. So captopril is going to be your answer. Here you can refer why it causes metallic taste. And we also discussed the ACE inhibitors and the side effects, and we also discussed what are the actions ACE inhibitor does. So a patient is prescribed a drug that blocks L-type calcium channel in vascular smooth muscles leading to vasodilation. Which of the following drug is most likely to be prescribed? All it is asking is which of them is calcium channel blockers. So pril, that means ACE inhibitors. Amiloride is a diuretic, or you can say potassium sparing diuretics. Amlodipine is a calcium channel blocker. Metoprolol, since it is giving lol, it is a beta blocker. So the correct answer without any hurdle is amlodipine. Here you can learn the mechanism of action and also you can see the correct explanation. Which antihypertensive drug works by stimulating alpha-2 adrenergic receptor in the central nervous system, leading to reduced sympathetic outflow and decreased peripheral vascular resistance? So there is only one drug which work on the alpha-2 adrenergic receptor in the central nervous system, which is an antihypertensive drug, and we have already discussed this, that is clonidine. So here you can see how clonidine works. The clonidine is centrally acting alpha-2 adrenergic agonist, stimulate the alpha-2 receptor in the brainstem, particularly in the vasomotor center. What it does, it reduces the sympathetic outflow. Activation of these receptor inhibit the release of norepinephrine, leading to reduced sympathetic outflow to the heart and blood vessels and kidneys. And what it does, it decreases the blood pressure. It decreases the blood pressure, decreased peripheral vascular resistance, heart rate and cardiac output. Okay, so since cardiac output is reduced, so systemic blood pressure is also reduced and diastolic blood pressure is also reduced. Okay, and there are few additional uses. This is also used in neuropathic pain. Okay, so you can also refer. Patient with hypertension and chronic kidney disease would benefit most from which of the antihypertensive drug? So patient is having chronic kidney disease and hypertension. So what do you think would be the drug of choice for him? Beta blockers? No, sir. Calcium channel blockers? Also no. Thiazides? No, sir. For ACE inhibitors, we have already seen, we discussed in the previous slide, that's for any kind of kidney disease if you are having, then the drug of choice is going to be our ACE inhibitor. So the people is having high blood pressure plus kidney diseases or chronic kidney disease, then we are going to have ACE inhibitors as our choice. So ACE inhibitor is the correct answer. So ACE inhibitors because they slow the progression of renal damage and reduce the proteinuria. Okay. So next question is, which antihypertensive drug is most likely to cause gynecomastia as a side effect? So here we have to find out a drug which is used in high blood pressure and which causes gynecomastia. So side effect of this drug is gynecomastia. Okay. So in the option you can see this is thiazide diuretics, this is potassium sparing diuretics, and this is furosemide, that is high ceiling diuretics. High ceiling diuretics. and this is amlodipine. So amlodipine is a calcium channel blocker, so basically it is out of race. So we are only going to decide between these diuretics. So chlorothiazide, no sir. Furosemide, no sir. Furosemide causes ototoxicity. This is also been asked in many competitive exams. So here the correct answer is spironolactone. So spironolactone causes gynecomastia as a side effect. So here you can see the explanation and we can move forward with it. And here also you can see in potassium sparing diuretic, it causes elevation of potassium, metabolic acidosis as well as gynecomastia. And in the loop diuretics, you can also mark this important for the ototoxicity and hypotension. Next we have which antihypertensive drug is most likely to cause reflex tachycardia as a side effect. So here we have reflex tachycardia as a side effect. So the answer is going to be very easy, because since we have already discussed in our previous lectures, the answer we know, we have hydralazine. So hydralazine is causes reflex tachycardia right from here. So see, all the points which are mentioned in the explanation area, these are the points through which questions are already have been there in the exams. Next question is, which antihypertensive drugs works by blocking of binding angiotensin to its receptor, leading to vasodilation and reduced aldosterone secretion. So now it is asking angiotensin II receptor blockers. So we have learned which are the angiotensin II receptor blocker, the drugs ending with sartans. So which of the drugs are ending with sartans? Sartans. Simple. So this is how you come to the conclusion. So let's discuss about the other ones also. Amiloride, we have already discussed. It's a potassium sparing diuretics. Amlodipine is a calcium channel blockers, and clonidine is a centrally acting sympatholytic drug, or we can say alpha 2 agonist in the brainstem. Okay, so with this I'm going to conclude this video. If you are liking this series, if you are liking the question and the explanation, don't forget to subscribe the channel so that all the information regarding GPAT, NIPER, pharmacist job vacancies should reach you at the very right time. So stay tuned to Pharmalix, and thank you so much for joining and all the support.